I just cannot pay the 25%. We literally don't have the funding to do it. And by the way, I don't believe any state will be in a position to waive the 25%. So I don't just say that on my behalf, I say that on behalf of all the governors. I'm the vice chairman of the National Governors Association. I've been speaking with governors all across the nation. No state has the financial capacity to participate, in my opinion. But I know for sure New York doesn't, because we are the heaviest hit state right now. I'm asking the President to do what I did here in the state of New York: cut the red tape, cut the bureaucracy, just cut to the chase, get the Army Corps of Engineers moving, get FEMA moving. Let's get those buildings up. Let's have them in place before that trajectory hits its apex. Time matters, minutes count, and this is literally a matter of life and death. We get these facilities up, we get the supplies, we will save lives. If we don't, we will lose lives. I don't mean to be overly dramatic, but I want to be honest, and that is the simple fact of this matter. We're also implementing the trial drug. We have secured 70,000 hydrochloroquine, 10,000 Zithromax from the federal government. I want to thank the FDA for moving very expeditiously to get us this supply. The President ordered the FDA to move, and the FDA moved. We're going to get this supply, and the trial will start this Tuesday. The President is optimistic about this, about these drugs, and we are all optimistic that it could work. I've spoken with a number of health officials, and there is a good basis to believe that they could work. Some health officials point to Africa, which has a very low infection rate. And there's a theory that because they're taking this anti-malarial drug in Africa, it may actually be one of the reasons why the infection rate is low in Africa. We don't know, but let's find out, and let's find out quickly. And I agree with the President on that, and we're going to start, Tuesday. I also think the FDA should start approving serological testing for coronavirus antibodies, and they should do it as soon as possible. What this does is it tests the blood to see if you have antibodies that were created to fight the coronavirus. Remember, all the health officials say the coronavirus was here before we started to test. Many more people have had the coronavirus than we think. Most people have resolved the coronavirus who have had it. How do you know that? You can test and find the antibody that the body created to fight the virus. If you have that antibody, it means you had the virus and you resolved it. Why do you want to know that? Because I want to know who had it, who has the antibody, which means they most probably will not get it again, and that can help us get our medical staff back to work faster. So it's a different level of testing, but I think the FDA should move as expeditiously as they have before on this type of testing. Find out who had it, who has the antibodies, and that will help us, especially on medical staff shortages. Also, on the state role, what am I supposed to do? I'm not just looking to the federal government. I understand that we are responsible here in the state of New York, and we're doing everything we can on hyperspeed. We have to expand the existing hospital capacity. This gets back to the 53,000 current beds when we may need 110,000 beds. We have said to the hospital administrators, we have a goal of you increasing your capacity in each hospital by 100%. Yes, an ambitious goal. Yes, very difficult. Yes, it may be impossible in some places. But remember, a hospital is highly regulated, space is regulated, the number of beds in a room is highly regulated. We're waiving all those regulations and saying, just from a physical capacity point of view, see if you can increase your capacity 100%. Where do we get 100%? We have 53,000 beds. We have to get to 110,000 beds. Everybody increases by 100%. We meet the goal. Simple. A little too simple, but we understand many hospitals won't be able to do it. However, at a minimum, hospitals must give us a plan to increase capacity by at least 50%. So we would be at about 75,000 minimum against the 110 need. We would still have to find additional beds. I understand that. And you see what we're doing with the federal government. There's an opportunity there. But every hospital, goal of 100% increase in capacity, mandate of 50% increase in capacity. We also have an intensive care unit bed issue where we have to increase the number of intensive care units. That is limited by the number of ventilators. What makes an ICU bed an ICU bed in this case? It's that the ICU bed has a ventilator. And that's where we get back to needing the ventilators desperately, so we have those ICU beds. We're putting out a Department of Health emergency order to hospitals that says we're not just asking you to do this. It wouldn't just be a nice thing. I'm not just asking you as governor as a civic obligation. This is a law that the hospitals must come up with a plan to increase capacity, a minimum of 50, goal of 100%. We're also canceling all elective, non-critical surgery for hospitals as of Wednesday. Elective, non-critical. If it's a critical surgery, fine. If it's not critical, then postpone it. That alone should get us 25 to 35% more beds. And again, that is a mandate that is going into effect for the hospitals. I understand the hospitals are not happy about it. I've heard that. The elective surgery is a big source of revenue for the hospitals. I understand that, but this is not about money. This is about public health. And we're putting that mandate in place starting today. We're also creating additional beds in places where we can. We're taking over existing residential facilities, hotels, nursing homes, and repurposing existing facilities. For example, this is the Brooklyn Center for Rehabilitation and Healthcare, 600 beds that we're going to take over, and it will serve as a temporary hospital. And we're doing this in facilities all across the state. Two different facts. I want to make sure we're clear just so there's no confusion. Fact one, young people can get the coronavirus. They are wrong when they say they can't get it. They can get it. 18 to 49-year-olds represent 53% of the total cases in New York. This is not China. This is not South Korea on the theory that, well, I'm an American youth and therefore I have a superior immune system than China or South Korea. No, that theory is not correct. In New York, 53% of the cases, 18 to 49 years old. Second fact, older people and those with compromised immune system, underlying illnesses, can die from the coronavirus. You're right, the 18 to 49-year-old is probably not lethal, but you can get it and you can get sick. And it's a nasty illness, and then you can transfer to someone else. That's the case for young people. Older people, obviously, if you're a vulnerable person, it can be lethal. Both facts are true, and both facts have to be understood. Young people can get it. You will get sick. You probably won't die, but you can transfer it to someone who may very well die. And you can transfer it even inadvertently without knowing you're doing it. You can touch a surface, walk away. A day later, someone can sit at this table and put their hand in the same place and contract the virus. I was in New York City yesterday. It was a pretty day. There is a density level in New York City that is wholly inappropriate. You would think there was nothing going on in parts of New York City. You would think it was just a bright, sunny Saturday. I don't know what I'm saying that people don't get. I'm normally accused of being overly blunt and direct, and I take that. It's true. I don't know what they're not understanding. This is not life as usual. None of this is life as usual. And this kind of density, we talk about social distancing. I was in these parks. You would not know that anything was going on. This is just a mistake. It's a mistake. It's insensitive. It's arrogant. It's self-destructive. It's disrespectful to other people. And it has to stop, and it has to stop now. This is not a joke, and I am not kidding. We spoke with the mayor of the city of New York and the speaker of the city council, Corey Johnson. I told both of them that this is a problem in New York City. It's especially a problem in New York City parks. New York City must develop an immediate plan to correct this situation. I want a plan that we can review in 24 hours so that we can approve it. There are many options. You have much less traffic in New York City because non-essential workers aren't going to work. Get creative. Open streets to reduce the density. You want to go for a walk? God bless you. You want to go for a run? God bless you. But let's open streets. Let's open space. That's where people should be, in open space areas, not in dense locations. There is no group activity in parks. That is not the point. We spoke about it the other day. All sorts of kids playing basketball yesterday. I play basketball. There is no concept of social distancing while playing basketball. It doesn't exist. You can't stay 6 feet away from a person playing basketball. You can, but then you're a lousy basketball player and you're going to lose. You just cannot do that. We also have bigger parks in New York City. We opened Shirley Chisholm Park in Brooklyn, 400 acres. Van Cortlandt Park. There are big parks. There are big spaces. That's where you want to be. But we need a plan from New York City. I want it in 24 hours because this is a significant problem that has to be corrected. In terms of numbers, I said yesterday New York is testing more people than any state in the country and per capita more than any country on the globe. That is a positive accomplishment, pardon the pun, because we want testing, we want more testing. We ramped up very quickly. We're doing it better than anyone else, and that is a good thing because when you identify a positive, then you can isolate that person, and that's exactly what we're trying to do. When you increase the number of tests, you're going to increase the number of people who test positive. And the numbers show exactly that. We have now tested 61,000 people. Newly tested 15,000 people. So these numbers just are exponential to what is being done anywhere else in the country. And that's why you're going to see much higher numbers than anywhere else. Total number of new cases, 15,000. Total number of cases, 15,000. Total number of new cases, 4,800 new cases. You see the state more and more counties. We're just down to a handful of counties now where we don't have existing cases. As I said, that is going to be 100% covered. It's just a matter of time. On the hospitalization rate, which is a number that I watch very closely, it's 1,900 cases out of 15,000, 13%. 13% is actually lower than it has been. We've been running at 15%, 16%, as high as 20%. This is 13%. This is the key indicator because this is saying how many people are going to come into your healthcare system as the number goes up. So this is not bad news. Across the country, you see New York now has 15,000 cases, Washington State 1,600, California 1,500. So we have roughly 15 times the number of cases. Now, do we really have 15 times the number of cases? You don't know. We're testing much more than anyone else. So that is a major factor in this. But I have no doubt that we have more cases. We have more density. We have more people from other countries who come to New York than many other states. So I have no reason to believe that we don't have more. I don't believe we have 15 times more. I believe that's also a factor that we test more than anyone else. 114 new deaths, total number of deaths, 374. And that is a sobering, sad, and really distressing fact that should give everyone pause, because that's what this is all about, is saving lives, and we've lost 374 New Yorkers. Keeping it all in perspective, Johns Hopkins has followed this from day one, 311,000 cases, 13,000 deaths. Statewide deaths, to the extent we can research the cause of death and the demographics of death, what we're seeing roughly, 70% of those who passed away were 70 years old or older. And the majority had underlying health conditions, okay? So it is what we said it was. Approximately 80% of the deaths of those under 70 years old had an underlying health condition. So, young people can get it, young people will get sick, young people can transfer it. Mortality, lethality, older, compromised immune system, underlying illness. That's what we're seeing. But even within that population, the capacity of our health care system can save those lives. It doesn't mean just because you're 80 and you have a compromised immune system or you have an underlying health condition and you get coronavirus, you must pass away. That's going to depend on how good our healthcare system is. But in terms of overall perspective, I'm afraid for myself, I'm afraid for my sister, I'm afraid for my child. Older, underlying illness, be very, very, very careful. This gets back to Matilda's law. This gets back to my mother. That's my fear. This gets back to nursing homes, senior care facilities, etc. Personal advice, this is not factual. I try to present facts. I try to present everything I know. I try to present unbiased facts. I try to present numbers, because people need information. When do you get anxious? When do you get fearful? When you don't get the information, or you doubt the information, or you think people don't know what they're talking about, or you think you're getting lied to. So I present facts. This is personal advice. This is non-factual. So it's all gratuitous. You can take it, and you can throw it in the pail. But we have to think this situation through. Don't be reactive at this point to this situation. Yes, you are out of control in many ways. You're out of control to this virus. You're out of work. Situations are changing. They're not in your control. You don't even know how long this is going to go on. It's a very frightening feeling. That is true. But you can also take back some control. Start to anticipate and plan what's going to go on. Plan for the negatives and plan for the positives. There are going to be negatives and there are going to be positives. There are real economic consequences. How do you handle the economic consequences? You're not alone. It's everyone in the United States. That's why you see this federal government acting quickly to get funding into the pockets of families who need it. But think through what the economics mean. Think through the social issues and the social impact of this. Think through the emotional issues of this. You know, it would be unnatural if you didn't have a flood of emotions going on. It would be unnatural. Either you wouldn't understand what was happening or you wouldn't appreciate it. But if you know the facts and you understand what's going on, you have to have a flood of individual emotions, positive and negative, and anticipate it. You know, stay home, stay home, stay home. Whether you stay home, remember the old expression, cabin fever, right? You stay home alone, you don't want to be isolated emotionally. You can be isolated physically. You don't want to be isolated emotionally. You want to keep those emotional connections. You want to talk to people. You want to write letters. You want to have emotional connectivity. That is very important. If you're not alone and you're in the house with the family and the kids and everybody's together, that's a different set of emotional complexities. You know, being in that enclosed environment, normally the kids are out, everybody's going to work, and you're only together a short period of time a day. Now you're all in the same place for 24 hours. You know, I remember when the kids were young, what it was like. It was pure joy. But I remember what it was like to be with them for multiple hours. You know, it's complicated. I live alone. I'm even getting annoyed with the dog, you know, being in one place. So think that through, because that is real, and it's going to go on for a period of time. This is not a short-term situation. This is not a long weekend. This is not a week. The timeline, nobody can tell you. It depends on how we handle it. But 40%, up to 80% of the population will wind up getting this virus. All we're trying to do is slow the spread, but it will spread. It is that contagious. Again, that's nothing to panic over. You saw the numbers. Unless you're older with an underlying illness, etc., it's something that you're going to resolve, but it's going to work its way through society. We'll manage that capacity rate, but it is going to be 4 months, 6 months, 9 months. You look at China, once they really change the trajectory, which we have not done yet, 8 months, we're in that range. Nobody has a crystal ball. Nobody can tell you, well, I want to know, I need to know. Nobody can tell you. I've spoken to more people on this issue than 99% of the people in this country. No